Hello, everybody. We're so excited to have you all here. For those that are watching live and for those that are going to come back and watch again, we're going to talk today about this webinar is coming from the American College of Surgeons International Relations Committee. And we're going to talk about the importance of being a champion in surgery. And a champion means what is the meaning of a champion? Is a champion, is a mentor, is a sponsor, is an intentional way of helping those around us. We're going to, I have the distinct pleasure of having these two leaders, international women leaders, and surgeons that are going to be here answering these questions. First, I want to welcome Dr. Isabella Frigeiro. Dr. Frigeiro activity focused primarily in pancreatic surgery. She has a lot of experience working in several humanitarian missions in the Balkanic area, Sierra Leone, and Burundi. She graduated from the Milan University, completed a PhD in hepatobiliary and pancreatic diseases at the University of Verona, and reporting the largest experience on RFA in advanced pancreatic carcinoma. Since 2012, Dr. Frigeiro is an active member of the European Digestive Surgery. In 2024, she became the president of this society. In 2015, she co-founded the first Italian Association of Women Surgeons in Italia. In 2020, the Association of Women Leaders leads, which she aims to reach gender equity in surgery at every level. In 2017, she started the first Italian fellowship program in pancreatic surgery at the Perelostoni Hospital and exported his experience in a larger program of surgical oncology led by the Italian Association of Surgical Oncology. Dr. Frigeiro is currently the secretary of the EAHPBA and leads the FERCH mentorship program, as she's also the vice chair of Women in Surgery Subcommittee for the IRC. Next, I want to introduce Dr. Jenna McLeod. Dr. McLeod is a seasoned consultant in general surgery with nearly 30 years of experience, specializing in trauma, critical care, and surgical interventions. Her background includes a BS in biopsychology and an MD from the University of British Columbia, followed by the Fellowship of Trauma Critical Care. Over the years, she has had many roles as leading surgeon at the Grady Memorial Hospital and consultant surgeon at Kiambu District Hospital. Committed to continuous learning, Dr. McLeod actively participates in courses and workshops and publications like Critical Care in Africa, a surgical intensivist perspective. Her priorities fostering strong doctor and patient relationships and delivering exceptional care to all our individuals. Welcome to our both esteemed panelists. Thank you so much for taking the time to be here with us today.
Thanks so much, Dr. Ferd. Thank you so much. So good to be here with you all.
So go ahead, sorry.
Just thank you for inviting me. And yeah, it's really a pleasure. I'm sure it's going to be an exciting discussion between all of us.
It's truly an honor to share this time with both of you that are recognized leaders and have done so much work for so many out there, women and non-women surfacing across the world. I wanted to ask both of you in your own words, and I start with Dr. Frigeiro and then Dr. McLeod. Tell me a little bit, what does it mean for you to be a champion or a sponsor in surgery? And how does that has shaped your career?
This is the main question of the whole webinar, and I can answer in two different ways. What it means to me be a sponsor for someone else, and what it has been to me to have a sponsor in my professional path. Because what I received is probably going to be a little bit different from what I'm supposed to give to another junior surgeon. Being a sponsor for a junior surgeon represents the way a senior and more experienced surgeon can provide this younger fellow with experience, with opportunities, with new opportunities to find a path of his or her career. And in a more practical way, it means that if I want to sponsor a junior fellow, I will need to proactively think about the way I can support and give him or her a practical help to develop specific skills or his or her opportunities to grow up in their career. And again, from a practical point of view, this might mean introducing him or her to other senior colleague and champion in surgery at the conferences, or provide them an opportunity for speaking or being part of a panel in an international conference to let them be known from the surgical community. And this will lead a lot of other effects in the time distance that can help them to promote their own career.
And Dr. McLeod, what are your thoughts about this?
Yes, thank you very much. I echo what Dr. Figueroa just said, but also I'd really like to make the point that mentorship has been increased in awareness, and we really are promoting mentorship, which is vitally important. But I'd like to really make a difference between mentorship and sponsorship. And I'd like to use the word sponsor or even advocate, because I think these are much more stronger words, because a mentor is someone that can even just be, give you sort of ideas of their work and be on a more sort of a relationship level, I would consider it sometimes a more personal level. But I think when we talk about sponsorship or advocacy, we're taking it to the next level of action. I think advocacy starts with an A, and I think of sponsorship in a more action-oriented relationship. And I think that we need to bring the awareness that you could still call it mentorship, but when you include sponsorship, it is a different aspect to that mentorship. I think it's a stronger, more action-oriented relationship. And I'm really glad that the ACS is working to try to basically increase awareness about the importance of having that in your career path. And I think that whether you're in an academic institution or whether you're in a county hospital, you're working in a clinic, I think you need to look in that environment you're in for a sponsor, for an advocate. And I think it needs to be intentional. And I think it needs to be something sometimes I think, like Dr. Isabella, I've had it in my career, but I think I didn't know what it was. And I think it was often just sort of something that fortuitously happened. And as a result, my career moved forward. But I think now we're moving into a space where we're telling individuals, we're telling our young surgeons, our young physicians, make it intentional. Step up and look for that person, and that it is different from a mentor, or it could be the mentor who then becomes more of your advocate person moving into action. Thank you.
Yeah, of course. And then tell me, for both of you, I appreciate us going into deep in the differences between mentoring, sponsoring, and being a champion and an advocate. But how does that really help women and people that are in minorities, or how does that help, for example, in competitive specialties? What would you say? I mean, what is the difference between just having somebody that is giving you advice versus somebody that is advocating?
I might start. I think we should share a common background first. And we are talking about the issue of the relevance of mentoring and sponsoring a woman surgeon, because actually there is a huge gap at this time between women surgeon and men surgeon, specifically in this field. There is the lack of mentoring and sponsorship is one of the main detrimental effects for a woman to pursue a surgical career, but other than that, even to proceed and progress in their surgical career. So this is an absolutely important gap to fill. And what a mentor and a sponsor, because I see these two different in some way, but with some aspects in common, different aspect of promoting a career, I can place these two different things in different stage of a surgeon's career. I would say the mentorship is probably more for a junior, and probably sponsorship will find more application on a mid-career surgeon. And going back to your question, sorry, because I tend to go broader. It is important to increase the effect on women surgeons, because in this way we will allow women surgeons. Sorry, I'm trying to switch it off. We will allow women surgeons to without barriers to proceed in their professional path and to develop fully their attitude and their skills and their potentials. And this is going to have an effect on the final result, that is going to be about the quality of the surgical service we will provide if we will invest on the other 50% of the surgical workforce. So there is all the interest from every point of view to invest in sponsoring a valuable woman surgeon during their career.
Dr. McLeod, what are your thoughts?
Thank you, Dr. Paula. I totally agree with all the comments that are being made, and I would just like to add that a lot of the gaps we see, whether it's minorities or women, and even some men as well, and like you said, competitive subspecialties, it's often about not recognizing the potential, and often related to, if that individual is not a known entity, then what happens is people default to implicit bias or stereotypes. The working paper that Heather Sarson's put out showed that when a surgical death occurred, the physicians not only didn't refer to that particular female surgeon, but actually to fewer female surgeons in general. In other words, lots of times individuals in certain categories become stereotyped if that individual is not known. So in other words, if I'm not known, I'm more seen as my gender than my potential. So I think a big role for sponsors is to give you opportunities that show what you're able to do. Because we all know that many times minorities, individuals, women, we're often very high performers. That's how we got where we are, despite the implicit bias. And so therefore, the potential in us is not often recognized. And the way to have that recognized is to have sponsors who, as Dr. Isabella was saying earlier, put us on the panels, give us opportunities to stretch ourselves, actually give us opportunities that other people think we may not be able to do, but actually we do and do well, to show that we have that potential for leadership and for career advancement. Basically help us to amplify our work. And often it's individuals that are in a position higher than us when it comes to sponsorship. I think mentorship is, once again, I think I agree there's a lot of overlap, but I think sponsorship oftentimes is an individual in a more of a supervisory role above us, or a more senior role, or a managerial role, because then they're in a position to offer us those opportunities that allow us to show what we're capable of, show our strengths, so that the implicit bias doesn't kick in. I don't think people specifically stereotype people in a conscious way, but I think if you know less about someone, you don't see their work, you don't see the things they're doing, you're more likely to default to a stereotype, which unfortunately sometimes isn't always positive about certain minority groups and about women. And as a result, our potential isn't often recognized. So I think sponsorship is key to career development, and often involves someone in a position of authority, or a position higher than us, or more senior, maybe not a person who has a position, but they're a senior partner who is highly respected, so that his or her word when they advocate on your behalf is heard.
So how does somebody, and I'm gonna give you two scenarios. How somebody that is junior faculty, just graduated a fellowship, how does she or he gets that sponsor? And how does somebody that is mid-career gets and finds and keeps that sponsor? Often you said, Dr. McLeod, you said it very astutely. We need somebody that can help us reach our true potential, amplify what we have, so we can work to our true potential. But how do you get that without for being perceived that you're tooting your own horn, especially when you're a woman, since there's so many biases against that, right? Women, in people's minds, women should be meek and quiet and not talking about their own accomplishments. But if you don't talk about your own accomplishments, you cannot have people like help you amplify that. How do you, as early career and mid career, for both of you, Dr. Frigier and Dr. McLeod, how do you what taking your own agency as a person that needs to be a sponsor? How do you do that?
I think that firstly, you have to fight with something that is called the imposter syndrome, that women usually do not really feel qualified for the task they are asked for, or for the duty, or for the surgical intervention they are required to perform. So we have to educate younger women surgeons to promote themselves because they're worth it. And this is going to be the first step. We said before that sponsors and mentors should be proactive by promoting and sponsoring and the juniors ones. But this is not only for them. Even the mentees and the protégés should be proactive by promoting themselves to the senior figure they think that really could make the difference for them. And this will create an expectation from the senior's point of view, and probably a stronger commitment to their career. So I think this is going to be the first aspect to work on. Promote themselves should be learned, and how to do it. And another issue I would like to mention is the fact that in this self-promoting process, usually men and women are seen with different parameters. Self-promoting men can be considered active and intriguing and very strong and proactive, and a woman doing the same thing could be misunderstood as too aggressive, too self-confident, too everything. So this is the first gap that we need to fill, to allow younger women surgeons to be able to promote themselves as a true professionals.
Dr. McLeod, what are your thoughts about that?
Yeah, thank you, Dr. Ferreira. Yeah, I think this is where this webinar hopefully is very key. And as much as I hope there are many young and middle career individuals looking to see what sponsorship is, to get a sponsor, I would like and hope that maybe some of our senior people are also clicking on, although that may or may not happen, because I think we need to develop more sponsors. I think, as you said, competitive subspecialties, competitive general surgery programs. It is a very competitive field in which we are in, competitive for patients. And so I think we need to develop more of a culture of community within our surgical specialties and our surgical field. The whole patient safety movement is based on team. And as much as we are talking about team in the operating room and the positive impact of that. We need to talk about team in a wider sense within our departments, because then that is going to promote more people to be sponsors, because it's going to be very hard for those of us looking for sponsors to find them if they're not there. So I think our first step, and a big step, is to encourage more individuals in the positions that are able to support, promote, advocate for their colleagues. And it may not even be someone who's a dean or a chair. I mean, you could be just more senior in the department. You may know the system better as to how you get onto a particular committee in the college, or in the American Board of Surgery, or whatever the aspiration is for the particular individual. So I think we need to also really promote and recognize sponsors, people who are doing that. I think that is first and foremost a way to now allow individuals to start to look for sponsors.
Those are great points. So tell me more, both of you, why you think it's critical that women in minority gain these sponsors, or tell me more about why locally that's important. Both of you have worked in different places of the world, and tell me why, like institutionally, locally, but also nationally, internationally, why is that critical?
Yeah, that's the point where it gets to an institutional level, because we have here a lot of different levels to work on. But at the end, if it's always at the same local level, local means department of surgical ward or operating theater level, is never going to get bigger and greater. So it is absolutely important to reach this awareness at an institutional level, because it's from the head of the institution that come the policy of the institution itself. And you reach the policy with spreading a culture of the meaning of sponsorship and mentorship. And I think if this becomes common in your workplace, this is going to become natural for probably the next generation. I think we are living a transitional phase, mainly in Europe, probably in the US, this is already established. But what I can see in Europe is that it's like we are discovering now the relevance, the difference between these three: mentorship, sponsoring, and championship. And actually the effect that these factors have on younger career. And what we have done previously, without knowing their names, we are giving this process a structure, and we are thinking of the relevance and the difference that this process can make in minorities in particular. When we thought that women were a minority in surgery, but now they are not anymore. So we should include women as a minority in surgery, I think, and we can discuss about this, because in Italy and Europe, we are almost 50% of the surgical workforce. So we are not minority anymore. We are half of the workforce. We should invest in the progress of career of women, men. We should invest in progressive career of everyone, valuable actually. So thinking about minorities, the problem is that we should start of having sponsor and champion among these minorities as well, so they could be represented as a specific group of people. Their feelings, their need, their point of view, their perspective could be represented in the surgical community. And this is going to have an effect on the surgical activity in general, and on the following surgical minority community as well.
Dr. McLeod, what are your thoughts? And I am like, you're absolutely correct. I have not thought about it this way. Women are not minority anymore. Yet we are where they're not minority anymore in the workforce, but we are minority when it comes with full professors. We are minority when it comes about division chiefs and leadership positions. So even though we're not minority in the actual worker bees, we are minority in representation and leadership. Dr. McLeod, what are your thoughts?
Yeah, and I think that's true for America, and so good to, that's why you saw me clapping, Dr. Figuerio, because it's wonderful to hear in Europe and Italy that it's 50-50, because in Kenya, where I live and work, from a vast majority of my time is we are not 50-50. When I came here in 2010, we were a definite minority. And when we have women in surgery groups getting together, the vast majority are medical students and young women interested in getting into surgery. Increasingly, we have neurosurgeons, orthopedic surgeons, but we're talking single digits. So I think it's important to hear individuals like yourselves who are coming from places where women are no longer a minority, but yet these issues are still present, because often what happens, it's more concrete to see numbers, and many times the idea that there's more minorities in surgery, there's more women in surgery, there's more diversity in surgery. Therefore, the issues of implicit bias and perceptions are no longer there. And I think yourselves are showing us that that's not the case, and showing those of us in countries like Kenya and other places in the world that still women are a minority. I was just in the International Surgical Week in Malaysia and met the first woman trauma surgeon in Malaysia. This is 2024. So I think there are still many parts of the world where we would be considered a minority, but we look to those places that are no longer a minority to say, hey, they're still having some of the same problems we are. So as we build numbers, let's not just rely on the numbers to solve some of these problems that are really not just number related, but being able to be at the table, being able to be recognized for the qualifications and strengths that we have, and be judged on an equal basis with colleagues who are similar to us.
Yeah, that's very insightful. I have a question from our listeners. Says, at what point of an aspiring female surgeon journey is the role of a sponsor most impactful? As a medical student, it's really rare to find a sponsor. There's a glaring lack of it before residency. I want you to, what are your thoughts?
I would say that for a medical student, as a medical student, you would probably not need a sponsor right now. You would probably have more benefit from a mentorship, which is more on a personal level and on a personal growth, and on understanding what can be more suitable for you in your future career, and how to direct your interest, and how to identify your true interest in medicine or in surgery in this case. So I see sponsorship more useful and more effective for an early midterm surgeon, midterm career surgeon, more than for a medical student. Even because they can realize what they sponsor for. A medical student is going to be a little bit too young to put in practice what the sponsor can do for you. You will have a lot of opportunities, but you would be too young to make them real.
Dr. McLeod.
Yeah, I would echo that sentiment that mentorship should be, as you begin in this field of medicine, and certainly geared towards surgery, that mentorship should definitely be your first step, for lack of a better way to say it. And I agree with those points. But I do think once you become into a workplace environment, let's call it that, and residency, internship is a workplace environment. And I think once you get into those environments, that's when I would say you need to start to be more cognizant of needing a sponsor or finding a sponsor. And I'm going to preempt what you probably is your next question, which is how do you do that? By adding that, I think first and foremost, making it a conscious recognition that you need to do it. And to start to look to individuals who are active, involved in the very a position of authority or a supervision, or a position where these or are active in patient care, and look for those individuals who have a voice and who are heard. So not just have a voice, but who are heard. And then look to develop a relationship with them in an honest, open way, not in a deceptive way, in a very honest, open way. And even to the point where I would suggest that you don't rush to this decision, but if you're in a workplace environment where you don't have a sponsor and you are not being able to aspire to the things that you would like to be able to do in your career, I think you need to think very hard about whether that's the workplace for you. And I recognize sometimes as residents and interns, we do not have many opportunities, but I think sometimes thinking about that is also not we sometimes feel like moving is a major thing, and it is, but I think we need to consider that as well.
That's a great point. So how do you, we establish that in many places of the world, women are still minorities, but in some places they're not minority, yet there's a minority of them in leadership positions, and there's still need for sponsors. How do you become a good sponsor? Because as you said before, a bunch of people come with biases, and when you're looking for a sponsor, you need a sponsor that is also a woman, that is also a minority, that is local. Do you need somebody that is outside of your faculty? Those two questions. What are your thoughts for both of you?
A good sponsor. First, I didn't want to be misunderstood about the fact that we are 50% of workforce, because we still have a lot of problems in proceeding
Exactly.
to leadership position. So number is power, but of course is not the only relevant thing to reach good results. To be a good sponsor, to me, it's essential to be free from personal interests in supporting your younger fellow. And I think that from that point, everything goes following, because this is the only way that you can truly promote free from prejudice. You can truly promote the advancement of your younger fellow. You can truly share your contacts, your international connection, your maybe the opportunities you did not have at the when you were at the same stage, and without fearing of losing something in your personal I can't get the word, I'm sorry, from your personal bag, I would say. So I think this is the first essential element.
Dr. McLeod, what are your thoughts?
I really couldn't say that better. I think I totally agree that sponsorship is a true sponsorship. If you're going to really do it, is an altruistic event. It's altruism at really at its best, because first of all, many of us, and I'm sure Dr. Figueroa and even yourself, Dr. Ferreira, we are come from a time and a generation where many of these things we're talking about we did not have, or we had very sporadically. I can think back to times where I wouldn't have some of the things I have if it wasn't at that moment someone stepped up for me. But it is not something we were aware of. It wasn't something that was ubiquitous. And so I think that it really, for those of us now who are in a position to start to sponsor, we need to make it as a cognitive, specific thing we do, and it's truly altruism. And it is truly looking, and I was reading how one person put it is speaking up for someone when they're not in the room. You know, we're very good about, cheering someone on and clapping for them when we're all together. But really, a sponsor is somebody who is going to speak up for you, will support you, suggest you, advocate your work, have people focus on the work you did, maybe not some, particularly as you were speaking earlier about women and personality differences in the way we approach things versus men, having us focus on the product, what we're doing, the work we're doing. I know I've had to keep track in the past of how many calls I did and how many weeks I on service so that the facts would speak louder than perceptions. And as a result, I think we really need to have people who are willing to be altruistic, to speak up when their sponsoree, is that a word? Have we coined a new word? Is like mentee, sponsoree, is not in the room. And that it means you have to have an excellent sponsor, because the person you're sponsoring is not going to see that necessarily unless it results in an advancement. But it's really about supporting someone when they're not in the room. And that's altruism.
Yeah, that is altruism. And I have give this a lot of thought, because I think in academic surgery, we measure success by publications, advancement to professorship. But wouldn't it be a much better world for all involved if we would measure success by how many people you help, and that altruism and helping people was not a strategy but actually a way of being? There's a ton of data now that shows that helping people actually improves longevity, gives a legacy, all of that. But how do we teach people to do that, right? I think Dr. Frugero said something really great, which was like, you have to do that not of self-interest. And it's an interesting thing in how do we shift the balance in academic surgery, that we're focusing more in helping people regardless of the gender or color of the skin or accent or language, right? And grow together in a better way. I don't know, what are your thoughts? How do we change this? How do we change the culture into be a more altruistic culture? Because that is all what it boils about, right?
This is not an easy question. How could we change the world about towards the work for equity and doing the right thing? We get a lot of criticism for that, because actually people do not really believe that someone could do things just because this is the right thing to do, of course, in a personal judgment. So this is not going to be an easy task, because there is always going to be someone who goes straight into the old direction and the old style, making you look like a fool. So this unfortunately, this is going to happen always. So what we should do, I think, is just don't care about that and going in the direction we think is the good one. And we said before, number is power in some way. I think we already are a discrete number of people seeing things in the same way, not in the same, but with the same perception of what is the right thing to do and what should be the right direction to give to our job and the way we do our job. And with more people coming from different backgrounds, talking about minorities, and more different perspective as surgeons, as patients, as surgical directors and residency directors and everyone, the more diverse the representation is, I think that this is going to be a key factor towards a different way of managing this huge surgical community.
Yeah, and we know
think,
yeah, no, I know,
sorry.
and we know it's okay. We know it makes patients better. We know it's better for outcomes for our patients as well. Dr. McLeod, I wanted to get your thoughts about that.
Yeah, I totally agree. I mean, and numbers are important because you know, we need a critical mass. It's when you have a critical mass that then you'll find those outliers will start to be outliers. And then, you know, the culture will be such that now the peer pressure is to be more a person who is willing to sponsor and be sponsored. And so I think numbers are important, and exactly as we become more diverse, that will help to shift. And also it's interesting how, especially in America, well, even in the world, football is so important. And my son's coach is always telling him, you know, he always wants to score the goal, pass the ball, pass the ball. I think we also need to develop a more reminding of that we win the game, so to speak, when we work together. You know, sports has that. That's their ethos. The team is everything, not the individual. You know, it's have a strong bench, you know, cover each other, those kinds of things. And really we should look at more of medicine being a team sport, because then we are much more likely to have that sense of what's good for one is good for all. And hopefully we will adopt that more and more and more. And I think as we get more people who think this way, and often women are more collaborative by default, not always, but in generalization, having to kind of fill in the gap and jump gaps often are a little more generalization speaking, because sometimes you can be jaded by what you've gone through. And I've seen many situations where, you know, people have been jaded by having them falling into their gaps. But we need people who've jumped the gaps and are not jaded by it, and take on the team approach that we're that much better when we all do this together, and really much more support of each other as colleagues. We need to, you know, step up when people are actually, when other people are sponsoring and putting people forward, we need to be stepping up more as well. And then that'll develop being a sponsor in yourself.
Definitely collaboration is the new competition. I have a question from the audience. It says, maybe workplace competition is also a factor that hinders surgeons from going out of the way to sponsor somebody in the same field. I think that that's a scarcity mindset, right? To think that helping somebody else get more opportunities decreases your opportunities. What are your thoughts? How can we change that mindset of scarcity to be a mindset of abundance?
Actually, usually a sponsor is someone means that you have a position, probably an age, and an experience, connections that the person that needs a sponsor does not have. So there is no possibility of a direct competition between the two parts, because they come from really different setting and different background, and they have completely different needs. I can say that even a sponsor might need some new opportunities for their career, but these are completely not going to fit with the protege needs and objectives. So there, if a sponsor has the same aim as a sponsoree, probably it shouldn't be his or her sponsor. Say they don't fit together. They have to look somewhere else. So there is there are no between sponsor and but there is sort of a natural selection for both of them.
Dr. McLeod, what are your thoughts about this?
Yeah, I think that's where you have to show some discernment and some wisdom in choosing your sponsor, because just as has been said, if if you're both aiming for the same aspiration, then it's going to be very difficult to have a sponsor who's willing to speak up and support you going forward. So I think that's where you have to show some discernment and look for someone who's in a position that's more senior, who's in a position where they're already have achieved some of the things perhaps that you would like to achieve, so that they could also be partially mentor, but also a sponsor for how they got there and helping you to get there. And so I think that's why it's really important to choose the right sponsor. I think also too, it comes down to recognizing that there is a lot more that can be done with what we have. You know, there's sort of the economics of the scale of economy. It shows that, you know, that's sort of how a lot of the businesses like Walmart work, right? You sell many, many more things at a very much smaller price. So I think that there's a lot of ways of still, you know, improving positions and improving opportunities. And when someone comes up with a new idea, then a sponsor should say, hey, well, maybe we don't have an organization for that, or we don't have that topic at Grand Rounds. So I think a sponsor is also someone who can help remove some of that competition or lessen it, or make you more competitive within that field by opening more opportunities and looking for more and more ways that we can basically all do what we want to do, which is move the surgical field forward. And I think if we also keep patience in the center of what we do, then that also helps to keep competition at bay a bit, because ultimately that's what we're here for, is patience. And sometimes, especially in the more academic and competitive environments, we often forget that completely.
No, that's very insightful. So how organizations like the American College of Surgeons, what can they do to empower sponsors, help people? And what can they do to empower people that don't have sponsors, find those sponsors? How can we be part of the difference for both of you?
Well, this is a really good question. And I think that sorry, Dr. Isabella, and forgive me for using your first names. It's just that I find I feel like I'm butchering your last names, but so forgive me for that. I think this, first and foremost, these webinars on sponsorship are crucial. And I'm so glad the International Relations Committee has done this. And I'm hoping this is the beginning of it spreading wider through the ACS, especially since the ACS leadership are the very types of people who have probably been sponsors and didn't even maybe put a name to it, or didn't recognize it as something that could be so much more formalized. So I think spreading what we're talking about beyond even just this webinar of the International Relations Committee, putting it on the ACS program, first and foremost, increasing awareness that there's something bigger than even mentorship, but sponsorship.
Yeah, and following what Dr. McLeod is saying, I'm really surprised about the echo of connecting with other similar group of people, in this case, women surgeons worldwide, can provide as new opportunities, maybe opportunities for sponsorship, maybe from someone coming from the other side of the world. And this event like this one really build up a bunch of new possibilities and new connection and a huge network where that we can rely on. And we said before that sponsorship is not about money. I'm not sure I 100% agree on that. Of course, sponsorship is not giving money to someone. But we know that, for example, academic research and academic career, I mean, you go through your academic career if you do relevant research. And you can't do relevant research if you have access to grants. And a sponsor can teach you, can teach you how to get access to financial grant for your research. can provide you advice and tricks and maybe the logistic support or the right connection and network to help you to access what you need to be effective in your research field. And so sponsorship has a lot of different ingredients, I would say. So, and these events like what we are having today provide a lot of these opportunities.
Fantastic. Go
Can I
ahead.
just add one thing? As I was just thinking as you were speaking, that also this is awesome because we can reach out across the globe, you know, Kenya, Italy, America, but also I think at a local level and even at like big meetings like ACS, having these breakfasts, lunch meetings, you know, special sessions, you know, happy hours in the evening. CMEs that are in person, because it's a lot harder to walk into someone's office who might be your supervisor or your boss and start to discuss something that isn't a direct relevant question to the day's work in the idea of developing a sponsor or seeing if this person could potentially be a sponsor for you. But many times connections occur in those more social environments or informal environments. So I think we really need to, especially in this era of virtual, which is awesome. I think hybrid is really the word I like, a bit of both. You know, I think we need to also look to have more in group events that allow mingling of sponsors and sponsorees, even if it's not called a sponsorship event, but an event that's basically a place where people can start to see each other on a more human and personal level and look to see who's the sponsor that would click for me.
And this is where surgical societies can make a difference by promoting these events like ACS is doing today, by making them possible in larger and bigger events, where people knowing themselves only from the name in the paper actually meet in person. And just to simply see that, I mean, they're only person surgeons, no gods on earth for the ones who believe it, but just person, where you can talk and share experience, ask for advices, ask for visiting, traveling, a lot of opportunities from a direct contact.
So I want to say I am in awe of both of you. Thank you for participating. Thank you for your time. I am inspired by everything that I have heard here. I'm going to summarize. Sponsor is somebody that speaks for you when you're not in the room, especially when you need somebody, when you need a voice. Sponsor is somebody that is able to see above and beyond the biases and give you a voice and see you for who you are, regardless of your gender, regardless of anything else, but help you and help everybody else focus on the outcome and give you opportunities. We talk about collaboration being the new competition. We talk about societies like the ACS giving us spaces for awareness, for mingling, for coming together. We talked about mentoring being a relationship of helping each other, but also a gateway for sponsoring. We talked about sponsoring also have an economical impact for research and gaining grants and advancement, academic advancement. And we talked about altruism and doing the right thing, because we need to do the right thing as people and as surgeons to help each other grow, keeping the patient in the center of all our decisions. It has been an honor to spend this hour with both of you. I am really hopeful that the people that are listening right now or after the fact can benefit from both of your wisdom and thought. And I cannot wait to meet you in person, see you again, Dr. McLeod, and meet you in person. Dr.
Yeah, for sure.
It has been an honor to be part of this.
Thank you so much. It really, I really enjoyed it, and thank you for the honor of being invited to come and share my thoughts today.
Thank you. Thank you. It was really a pleasure to share these thoughts with you all.
Before we sign off, again, I just want to make a couple of quick announcements. And first, thank you, and Dr. Ferrata as our moderator for today's webinar. Thank you for such a great moderated discussion. As a reminder, this is actually part one of a two-part series on championship in surgery. Registration for the next webinar, how to be that champion, how to be that sponsor in surgery, will be opening soon, as the webinar should be in December. This webinar has been recorded and will be posted on the ACS YouTube page. You may also view past webinars on the ACS YouTube page under the Global Surgery playlist. I would also like to mention, since we talked about different levels of surgery, residents can become members of the American College of Surgeons for free this year. So this is a great way for our residents to kind of dip their feet into our surgical societies and get that experience. And lastly, if you have any questions or feedback on this presentation, please contact me or any of the other IRC staff. Our information is on the screen. Once again, echoing all that has been said today, thank you everyone for your participation and for attending today's webinar. I hope you have a great day. Bye, everyone.